Hello everyone, my name is Sajni and my topic is about the drug methotrexate. Methotrexate is a drug used primarily to treat rheumatoid arthritis, but it's also a drug used for the treatment of cancer. Methotrexate works by inhibiting an enzyme known as dihydrofolic acid reductase. It's an enzyme important for transforming an inactive form of folic acid into an active form. This transformation is necessary to produce the building blocks needed for DNA production. By inhibiting this enzyme, methotrexate interferes with a cell's ability to repair and replicate itself. Methotrexate is also able to inhibit purine and pyrimidine synthesis that is used for the efficiency in the therapy of cancer. So an example of pyrimidine synthesis is mentioned in figure 9 from the book when the C to C to T to T mutation occurs. C and T are both pyrimidines. So in this example, they are showing the frequency of the CC to TT mutation when it is triggered by UV radiation at a dipyrimidine site and when it is not at a dipyrimidine site, meaning when the cancer is not caused by UV radiation. UV radiation is a type of radiation that causes cancer because it damages DNA. As shown in the figure, C to T mutation, exposure to UV radiation causes the increase in skin cancer, while there is a low frequency associated with internal cancers. While vice versa, when there is no exposure to radiation, there is an increase in the frequency of internal cancer and a low frequency in skin cancer. Methotrexate interferes with the endozyme pathway. So in this pathway, endozyme acts on endozyme receptors, and it plays an important role in the anti-inflammatory effects on methotrexate. This pathway is associated with methotrexate, helps maintain the efficiency while it diminishes toxicity of the drug. The endozyme pathway in cancer cells is when there is an increase in endozyme levels of cancer tissues due to genetic alterations that occur during tumor progression. An endozyme interaction with your receptors and neoplastic cells interferes with cancer proliferation, apoptosis, and metastasis. In normal cells, endozyme activates GPCRs, which converts ATP to cyclical AMP, which is required for intercellular signal transduction. So some common side effects of methotrexate are mouth sores, nausea, vomiting, diarrhea, hair loss, and eye irritations. Some severe symptoms are blood and urine or stool, jaundice, which means a paleness, some unusual bleeding or bruising, fatigue, inability to eat or drink, kidney toxicity or failure, and a low red blood cell count. These symptoms occur because there is a depletion of folate from the body, which affects healthy cells in the GI tract, mouth, hair follicles, and the liver. This is related to methotrexate mechanism of action, as I mentioned earlier, because of the enzyme dihydrofolic acid reductase activating folate, which is essential for making red blood cells and repairing the synthesis of DNA and RNA. So my question is, what is dihydrofolic acid reductase and why is it important? Thank you for watching.